This is Sarah. Sarah is 37 years old. She's currently 13 weeks pregnant and about to see her OBGYN. This is her second pregnancy. Her last pregnancy ended with a miscarriage. During Sarah's exam, her doctor notices that her cervix is dilated more than it should be. So, the doctor asks Sarah if she's been experiencing any pain, which Sarah denies. The doctor explains to Sarah that her cervix is incompetent. He shows her what a normal cervix should look like. It should be several centimeters in thickness and the mucus plug safely in place. He then shows Sarah what an incompetent cervix looks like. It is thinner than a normal cervix, which puts her at risk for premature birth or miscarriage. Sarah is scared for the safety of her baby, but the doctor tells her that this can easily be fixed with a cerclage. Cerclage is a procedure in which stitches are used to close the cervix during pregnancy. The doctor explains to Sarah the reasons for cerclage can include history of second trimester miscarriages, previous surgeries of the cervix, damaged cervix by abortion, and risk for premature birth. However, a doctor may discourage this procedure if the patient has vaginal bleeding, preterm labor, an intrauterine infection, preterm premature rupture of membranes, a pregnancy with multiples, such as twins or triplets, and fetal abnormalities that can lead to fetal death. So, Sarah will undergo a series of screening tests to rule out any of these complications. Her doctor will perform a thorough exam of her cervix, including a transvaginal ultrasound. Her doctor also explains to her the risks associated with the cervical cerclage. These include infection, vaginal bleeding, tear in the cervix, prolapse of the fetal membranes into the vagina, preterm premature rupture of the membranes, preterm labor and premature birth, and miscarriage. There are two main cerclage methods that Sarah's OBGYN may do: the McDonald and Cerclage. Both are performed vaginally, require regional or general anesthesia, and are equally effective. To place the McDonald cerclage, the doctor will put stitches around the opening of the cervix and then tie the ends of the sutures to close the cervix. The Cerclage procedure is performed if the cervix is too short or damaged. During the procedure, the doctor will tie around the neck of the cervix to close it. The best time for the cervical cerclage procedure is in between the 12th and 14th week of pregnancy. Sarah is in her 13th week. Her doctor decides to perform the McDonald procedure for her. They will later be removed about 37 weeks of gestation, or if Sarah has a C-section, the sutures will be removed after. After Sarah's cerclage is placed, her doctor uses ultrasound to check on the fetal well-being. Since this is an outpatient procedure and Sarah doesn't have any complications, she's allowed to go home the same day. Her nurse explains to her that she should expect some spotting, cramps, and dysuria for a few days. She should contact her doctor if she experiences symptoms like contractions or cramping, lower abdominal or back pain that comes and goes like labor pain, vaginal bleeding, a fever over 100 degrees Fahrenheit or 37.8 degrees Celsius, or chills, nausea and vomiting, foul-smelling vaginal discharge, or water breaking or leaking. Sarah is instructed to avoid physical activity for the first 2 to 3 days, including sexual intercourse. For the rest of the pregnancy, Sarah is seen once every 1 to 2 weeks to ensure that her cervix remains closed and no complications from her cerclage occur. At 37 weeks, Sarah's OBGYN decides to remove her cerclage sutures, and 2 weeks later, Sarah delivers a healthy baby girl. If Sarah plans on being pregnant again in the future, she will have a cerclage placed again.